Hello, everyone. My name is Dr. Z. I am a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new on here or regular viewer that has not yet subscribed, please make sure you do subscribe. That way you are helping a lot of other people find this content. Also, if you don't yet follow me on Instagram, link is below. Make sure you follow me on Instagram. I would love to connect with you on Instagram. That's where I show up for all of you daily with additional tips, guidance, and I also do Q&As on Instagram. So make sure you connect with me on Instagram. For today's video, I will be sharing with you three very foundational, important big reasons why starting feminizing hormones before actually starting social transition may be to a very, very big benefit for a lot of you. And I will explain why, and that way you can see whether this is something that seems like optimal for you. I will be talking about feminizing hormones specifically because feminizing hormones are one of those things where in the beginning, a lot of people can go all the way up to 3 months without experiencing any very large outwardly external changes that may communicate to people around them that they are going through physical gender transition. Whereas masculinizing hormones are different. People do see drastic masculinizing results sometimes even after 1 week of being on masculinizing hormones. So this is why this is specifically tends to be very conducive for those of you who are interested in starting feminizing hormones. This video is also clearly for adults. Lately, my channel has been a little bit targeted, so let me just reiterate, adult audience only, because I only work for adults. So this video is specifically for all of you out there who are adults, who also already know that you do have gender dysphoria, and you already know, or at least you already know that you identify as trans feminine, maybe non-binary femme, and you are interested in feminizing hormones. Feminizing hormones is something you've been wanting to do. Part of feminizing hormone regimen is part of your medical transition goals. And if you fall into this group where you're already thinking about feminizing hormones, and yet you may be thinking that, oh, I gotta do social transition first, or in which order things should go, this is a great video for those of you. So quickly, social transition is basically social elements of gender transition: coming out, choosing your pronouns, letting people know your pronouns, perhaps already selecting your name, going by your authentic name. It is socially expressing and presenting more in your authentic self. Basically, it's all of the social things that you can think about in relationship to your gender identity. A lot of times people think that social is the starting point of any gender transition, and that is very, very untrue. And that's untrue because there is no one way to go through gender transition. There's only your way. I can't stress it enough. There's only your way to go through gender transition. And the reason why there is only your way to go through gender transition is because your circumstances are going to be different than somebody else's circumstances. Your access to care is going to be different. Your psychological composition and makeup is going to be different. How you feel about yourself is going to be different. What you might be already struggling with is going to be different. What your support system is like. All of those things play a very significant factor when you are trying to establish in what order or what things you should do first. All of those things should definitely be considered. In the very least, that's what I do when I work with individuals who do want to go through gender transition, is I assess all of that, and based on all of those things and more, I create a plan for them that is very in alignment with who they are and their life and their circumstances. And when the plan is that much more tailored to your needs, what happens is you're eliminating a lot of things that you would be otherwise be very concerned about. Think about it this way. The more tailored gender transition plan is to you, the more you are controlling for all those extraneous variables that otherwise might pop up, that may spiral you into feeling a tremendous amount of anxiety, or feeling like you're out of control, or bringing up all the other types of elements. So social transition, as I already said, is not the first step for a lot of individuals. For those of you who are watching who do want to start feminizing hormones and been thinking about starting feminizing hormones, here's some of the three really, really essential important reasons why starting hormones before any other steps, before even coming out, can be a best option for a lot of you. Uh, Before I mention those three steps, I also want to say this. A lot of you are not ready to come out yet. A lot of you may feel like you don't feel the amount of confidence, the amount of assertiveness. A lot of you may feel like you're just not there yet. And that's another reason why doing hormones before all of those things is going to be so helpful to a lot of you. The very first reason why hormone therapy before social transition or before any other transition steps is going to be so helpful is this, and this is the big one. For those of you who are struggling with gender dysphoria, and depending on the severity of your gender dysphoria, it is going to drastically quiet the noise of gender dysphoria inside of your head. It is going to take that mental angst from a very high painful degree to drastically quite decrease it. Will it completely make it go away? Probably not, but it will give you that peace of mind. It will clear up that mental fog a lot of you experience as a byproduct of gender dysphoria and allow a lot of you to start thinking and seeing things more clearly. Clarity is really important when you are then planning future tailored transition steps to take. So the very first one, and this is again, like I said, a big one, it quiets down that noise. When you have gender dysphoria inside of your head space that is making so much noise, it's almost as if your head space is a hotel that you own, and in this one room on the top floor, you have a rock star there who also enjoys getting in all sorts of inappropriate behavior, makes a ton of noise, wrecks all the furniture. Well, it's really hard for the rest of the tenants below that rock star to be able to get peace of mind. Dysphoria is the same way. So when you have a racket going on in your head space, when you have that mental fog, when you have that mental confusion and mental angst constantly taking place, well, guess what? Even if you do social transition step first, even if you come out, even if you go by your preferred pronouns, all of those things are great and super important. By this biochemical, and we are talking about the biochemical neurological element, can only be alleviated to a bigger degree where you can actually feel the benefit from it by introducing the hormone that should have been in your body to begin with. So that's why that first one is so crucial and so important. A lot of people, when they start taking hormones, they report feeling the sense of clarity, feeling the sense of mental angst going down. And that in of itself helps a lot of people to plan things, to start making future outline of the things that they want to do. So that's the first one. It's going to quiet the noise of gender dysphoria and bring you a ton of clarity. The second reason why studying feminizing hormones before any other transition elements, including social transition, is that it is going to make you feel affirmed that you are on the right track, affirmed that you are doing the right things, and as a result, it's going to increase your confidence. When your confidence and your sense of affirmation go hand in hand, when they meet and when they join hands, what happens is that you suddenly feel not only is that you are on the right track because you have this confirmation, but you also feel like you're now empowered and you now have more of an ownership over yourself to then do other elements of social transition. For example, coming out. Now that you've been on hormones for at least a month or maybe several weeks, you feel more like yourself. Remember that mental angst is going to quiet down, you're going to have clarity. On top of that, your confidence goes up. Now you feel much more equipped to come out. Now you feel much more equipped to tell somebody, hey, these are my pronouns. Now you feel more equipped to start presenting yourself in your authentic gender, because all of those factors are going to make things so much easier. And guess what? You're also in a better position and you are in a much better mental state because the dysphoria is quieting down, your confidence went up, your sense of affirmation went up. Well, guess what happens? You are in that much more better position right now to take on any challenges, and there will be challenges coming your way. anything from misgendering to anybody that you come out to pushing back on your authenticity. Perhaps you have family members who are going to try to confront you and have a confrontation with you about your gender. You'll be in a better place to have those discussions. You'll be in a better place to have those dialogues because you will know, I already am on hormones. I know that as a byproduct, I feel so much better. I know how instrumental they are. I know how much benefit they're bringing to my well-being, and that's going to help you. When you haven't yet experienced, and again, remember this video is for everybody who wants to do hormones, right? So when you have not yet experienced the biochemical, how should I phrase it? Uh, the balance that really should be neurologically within your headspace, when you haven't yet experienced yet, it's very difficult to believe that things will get better. So it's very difficult to stand your ground. But when you have experienced the benefits, the health benefits, and as a byproduct you feel better, well, then you start feeling like I owe this to myself to take care of my health. And that makes all of the difference. So that's the second one. It's going to help you feel more affirmed, and it's going to make you feel more confident. And in a combination with the clarity and the mental angst going down, you're in that much position to then tackle social transition. And the final one, and also a very big one, it's going to make you feel like you're finally in control of your life. Now, I know we often talk about how control is an illusion, and it is absolutely an illusion. I mean, ultimate control doesn't exist because, you know, we can't control all of the variables. We can't control all of the circumstances. And a lot of us do know that even if I plan out tomorrow, I can't fully control tomorrow. I can only control tomorrow to a certain extent that I'm capable of controlling tomorrow. But if I go get in a car and drive to work, even though I have all the things planned out, if somebody's going to rear end me, well, guess what? My chance of controlling things just flew out of window, and now I find myself in a new circumstance. So yes, control is an illusion. Nonetheless, control is also a state of mind, and control is also a state of mind that either helps us feel anchored and grounded in something, or when we lack that control, that state of mind, we are orbiting, we're floating, we are really like a balloon with a string flying around without somebody pulling us down. So control is equally, while it's important not to get yourself really lost in a desire of controlling everything, it's equally important to understand it as a state of mind. And starting hormones will absolutely make you feel like you are in control of your health, and you are in control especially of your life. And here's why. A lot of you who've been thinking about hormones have been living with gender dysphoria for many, many years. The longer you've been living with gender dysphoria, and the longer you have not been able to do anything about it, for whatever reasons, personal or otherwise, is the longer you've been feeling in a state of mind that is powerless, which is a state of mind without having any control. You may have felt like things are never going to change for you, things are never going to get better for you. And that state of powerlessness, that state out of control, is exhausting. It robs you of hope, of possibility, of hopefulness. It's a dream eater, it's a soul eater. So when you actually take the first step to do something about your gender dysphoria, in this case, starting feminizing hormones, you will automatically feel better because it puts you front and central into this headspace, this mindset of control, because it's you who decided to do it. We always say that experiencing gender dysphoria is not a choice. Having a transgender identity is, it's not something people necessarily choose, although some people may say they do choose. Gender dysphoria absolutely and doubtfully is not a choice people make. However, what you do about once you are aware that you have gender dysphoria is absolutely undeniably a choice. You can choose to step into gender affirming care. You can choose not to. You can choose to start hormones that you've been thinking about, or you can choose not to. And so when you make the choice stepping into feminizing hormones, that is a sense of control. That is you now, you actively doing something, you actively being active participant in your life. Life is not happening to you. You are creating your destiny. And that's very powerful. That's very meaningful. Now think about combining that element of control with other things that I just said earlier. All three of them create a very powerful triad as a byproduct of studying feminizing hormones before social transition. The triad of, again, at the top of triad, clarity of mind, quietening the noise and mental angst of gender dysphoria. At a corner of the triad, right there, you have feeling affirmed, feeling confident, starting to feel that shift in perspective of what feeling better can actually be like versus constantly feeling worse. And then your final corner is, yes, I can do this. I'm in control of my life. I can make this happen. This is possible. You suddenly went from hopeless to feeling hopeful. This is why, my friends, starting feminizing hormones for adults who also know that they're trans, who also know they have gender dysphoria, who also want to start feminizing hormones, doing all of this before you even start social transition is beneficial. Now, sure, there are some people out there who social transition is benefits them even more than starting hormones. It gives them all of those things and more. But by far and large, what I see for people is, in fact, in my practice with a lot of people, that's a lot of times what I recommend. Okay, let's get you started. So that way it's almost, for those people who need hormones and want to do hormones, I like to think about hormones as essential nutrient, right? Not only either the essential hormone to balance out the biochemical in the brain, but it's really essential nutrient. And imagine, I always imagine it's as if the clients I work with come to me who want to be on hormones, they're starving, they're malnourished. It's akin to being deeply dehydrated. When you go to a hospital, what's the first thing they do? They put an IV into you and they hydrate you, right? That's before they even decide the further course of treatment. I like to look at it a similar way. And then when you start getting hydrated, when you start getting balanced on a right hormone, then a lot of things can follow from it. Now, do I recommend for people to be on feminizing hormone beyond 3 months period? It's up to you. I can't tell you what to do and what not to do. In my opinion, 1 to 3 months is just right enough to rally the strengths inside of you, to give you that motivational boost to do all of the things. Once you go beyond 3 months mark, what I find is this boost, this sense of feeling affirmed and confident, all of those things that basically push you to move further starts to wane off, starts to hit plateau, and then can push a lot of people back into secrecy, back into not doing anything about it. So I say between 1 to 3, it's almost like you want to use the spirit as an opportunity. You want to use this feeling of this boost as an opportunity to ignite, that's a good word, to ignite the steps you're going to take forward. Comment below, let me know if you have taken hormones before you started social transition, how it worked out for you. If you are now in a position where you really want feminizing hormones, but you've been thinking that social transition need to happen first, how does that change for you the outlook or your thought process? Comment below. Love reading all of your comments, and I will see you all next time. Goodbye.